Global efforts to control malaria have saved an estimated 3.3 million lives since the year 2000. The battle has been won in 4 countries in the world, including the United Arab Emirates and Morocco, that have been certified by the World Health Organization as having eradicated malaria, a life-threatening disease caused by the parasite transmitted from Anopheles mosquitoes. The disease still kills an estimated 600,000 people every year across the world, especially in Africa. 35 countries are responsible for 98% of the total malaria deaths worldwide and also contribute to 96% of the total number of malaria cases. 30 of these are in Africa.
It is something we're going to strive to. We won't actually know if we'll be able to meet our targets until after 2015, but I know that a lot of efforts is going into ensuring that those key targets are met. A lot of funding, a lot of commitment has been done by state governments and partners to try and ensure that all preventive measures that should be used are currently being used.
The objective is to reduce the mortality rate to near zero by 2015, which is why the theme for this year's World Malaria Day is Invest in the Future, Defeat Malaria. The essence of the World Malaria Day is to shed a spotlight on efforts globally to control malaria. This group of individuals here in Lagos are trying to contribute their quota to the Rollback Malaria Plan. Poor housing plan, poor sanitation, and poverty contribute to the prevalence of malaria, with peak transmission in the rainy season.
A healthy home is the pivot for a healthy society, and therefore everyone must be involved in malaria control. The second is that we must all be active in ensuring that our environment is clean and free of any collection of water that can serve as a breeding site for mosquitoes. Everyone should sleep inside a long-lasting insecticide net every night.
11% of women who die in pregnancy and childbirth die of malaria. 20% of children who die before the age of 5 also die of malaria. The World Health Organization wants partners and government all over the world to increase funding for the battle to defeat malaria, but individuals also have a role to play.
We need to take responsibility because there's just so much government can do on its own. One of the things we strongly advocate and want to sensitize and promote and educate is the use of multiple drugs in the treatment of malaria. Every fever is not malaria fever, and we need our people to understand that if you're feeling feverish, yes, the commonest thing would be malaria, but you need to do a rapid diagnostic test.
Malaria slows down economic growth and development in Africa, yet it is preventable and treatable. Wendy Abo, TVC News, Lagos.